Hi, my name's Amy. I'm going to be your student nurse today. We're going to just do a quick dressing change on you. What's your name and date of birth? Perfect. Do you have any allergies at all? No? All right, are you in any pain? No pain? Perfect. We're going to take this dressing off and then we're going to put a new dressing on. It's going to be a wet to dry dressing. So we're going to just see how your wound is looking. Just gonna gently peel this up for you. Perfect. All right, I don't see any discharge right now. The color of the wound is a pinkish reddish. I don't have there's no odor smell to it. All right, I'm just gonna take my sterile Q-tips and we're going to get this old dressing out. Let me know if you have any kind of pain with this. Okay, perfect. We're gonna throw those away. All right. So there's no odor, no discharge. All right, so now we're gonna measure. The edges are non-proximate. And we'll do the size. We're gonna measure in metrics. Okay. Okay, so got 13. And then we're gonna measure in the widest part of the wound. And we got 3. And now I'm going to take a sterile Q-tip. And I'm gonna just measure the depth of the wound. If you have any pain, just please let me know. I'm gonna use my finger. Perfect. And now I'm going to measure. And it looks like it is 3. So we have a wound of 13 by 3 by 3. Now I'm going to discard that. I'm gonna take my gloves off. And I'm gonna wash my hands and then get my sterile field set up. I'm also gonna look at the order, and it looks like the doctor ordered 0.9% sodium chloride, which I do have that. It's today's date, expires March of 2029. Okay, so I'm gonna set up my drape. My drape, I'm going to open my surgical sponges, making sure I keep everything sterile. Q-tips. Right, I'm going to open up the bowl. Perfect. I'm going to add my solution to the bowl. Okay, so now I'm going to put my gloves on. I'm not going to turn my back to the sterile field. All right. I'm going to make sure that my gloves do not get into my sterile field. now that I'm sterile, I'm going to put my gauze into the solution. All right, now that the gauze is take my sterile Q-tip and then we're going to start packing the wound. Let me know if you have any kind of discomfort, please. You doing okay? All right. Now that the wound is packed, I'm no longer sterile. I'm now going to put a new pad on the patient. And we're gonna tape it down. And I have my piece of tape here. It has the date, the time, and my initials when I change the dressing, so then the next nurse knows. And I'm gonna document my findings. Thank you.